I'm Dr. Brett Levine, and I'm the Director of Adult Reconstruction here at MedStar Georgetown University Hospital. In high school, I worked with my dad on cars, and so ironically, a lot of the instrumentation that we use in medicine is not that different from working on a car. I got really good at taking apart cars and transmissions and putting them back together exactly how they came out. And then I came to undergrad here in Washington, D.C., worked at the hospital here, and then saw a total joint replacement by Dr. Brian Evans. And that was it. I was hooked. I saw what he was doing, the instrumentation he was using, the way the surgeries went, and I said, that's what I have to do. And then seeing the patients in clinic and how they do and how they're so grateful, that was just icing on the cake. My specialty is adult reconstruction, which encompasses hip and knee reconstruction, mostly basically replacements, some trauma work around that area as well. But it's from as little as partial replacements of the knee all the way to replacing a full femur bone as necessary. When I was an undergrad at American University up the street, I volunteered at the hospital on 6 Main. I worked for about a year, and then they hired me as an ortho tech. And I worked for 4 years as an ortho tech through my graduate degree, my first 2 years of med school. It was fantastic. I got to meet all of the giants back then. Dr. Evans was just starting, Dr. Lauerman, Dr. Delahaye, Dr. Weasel. And so it was always great. I love my experience here and always said that one day, if the opportunity ever presented itself, I would love to come back and be that guy that was teaching me. And so, time went on. I went out to Chicago and I practiced there for the past 16 years. And all of a sudden, this opportunity started to look like it might be opening. And then I reached out to Dr. Evans and we had a great conversation. And for me, this is like coming home. I like working with patients. I love teaching residents, fellow students, whoever I think will listen to me, because I love joint replacement, all aspects of it, from the littlest of partial replacements to the most complex revisions. It's a great field in that everybody's different, even though it's the same surgery, a knee replacement, but everyone's anatomy is different. So a knee replacement is not a knee replacement for everyone. You have to do different things in each case. So every day's new, every day's exciting. It's a great specialty. That's what gets me up every day to come to work. I do take my time in clinic, and when I see them, they will see me rounding on them in the hospital much earlier than they want to see me. And so have some patience in clinic because I take time with each person. So when I'm there, it's individualized care. Everybody gets what's best for them, which will be different than the next person that walks in. So, I just ask for a little bit of patience because each person will get their time. I'm not going to cut anybody short. The type of patients I see, again, are all comers. So I like to see people obviously with hip and knee because that's my specialty. Whether it's an initial evaluation just for early arthritis and requires injections and stuff like that, and building a relationship before having surgery to people who come in with implants that are loose or infected, for revision. So happy to take care of all those patients from the simple primaries to the more complex revisions. It doesn't matter anatomy, shape, size, whatever it might be. Take all comers and try to figure out the best solution for each person. So I think a better question is why shouldn't they choose Georgetown as for their care? It's a great facility, brand new operating room. It's got great facilities on the floor, the nursing staff. I can't say enough about all the people that work here. You're going to get great individualized care. It's in a great location. It's got a great view of downtown from the new tower there. So really, I can't think of any reason why you wouldn't want to. You're going to get comprehensive care from for joint replacements, that includes plastic surgery when necessary, infectious disease when necessary, the medical team when necessary. So not all joint replacements are simple and easy. Sometimes we need the help of others, and we have all that right here as one big package. So I would pose the question more, why not come here? Because I think this is the best place to receive your care.